Spinal trauma can change a life in an instant, and researchers are racing to improve outcomes. In this video, we'll talk about what spinal trauma actually is, the recent high-value papers from the last few years about this topic, and a complete guide on what you need to do if you want to write a research paper on this topic yourself. Spinal trauma usually occurs in shallow water diving, motor vehicle crashes, and falls. Usually, a lot of damage is needed for young and healthy individuals, but even minor damage can cause serious injuries in older or more medically fragile patients. So what should you do if you realize that someone has spinal trauma? Well, first of all, in order to prevent further injuries, you need to immobilize them first. You can use a cervical collar, and of course, you need to have proper head supports. And you need to assume that a spinal cord injury has happened if the patient is showing signs of other neurological problems, or if they're complaining about spinal pain, and also, of course, if they're confused. Clearing the spine is only possible if there's no midline tenderness, if there are no neurological deficits, and if the imaging and radiographs are normal. You normally see neurogenic shock in injuries above T6, and one of the main signs of it is hypotension. Now let's take a look at some of the most important research papers that were published about this topic recently. So in 2024, a paper was published which compared the outcomes of different surgeries that were done 8 to 12 hours after the initial incident, 24 hours after the initial incident, and those that were delayed beyond a day after the initial incident. So the results were striking. They showed us that time matters. The faster the surgery had been completed, the less complications the patients had after their hospital stays. And also their hospital stays themselves were much shorter. They reinforced one of the most important themes in neurosurgery, the fact that time is important. In 2025, another meta-analysis took this question even further. It looked at over 2,300 patients from multiple studies, and they found some interesting results. Firstly, the earlier the surgeries, for example, 12 hours after the initial incidents, they actually gave the best results, and they gave the least neurological problems at the end. Interestingly, however, complications and mortality rates were about the same, meaning that earlier surgeries give better outcomes without added risk. Another fascinating contribution came from BMC Medicine in 2024. It compared the different causes of deaths from the year 2000 to 2021. This study was massive and it was global, and it revealed some pretty interesting things. So in developed countries, less people were getting spinal trauma from road crashes, but more elderly people were getting spinal trauma from falling. And the lack of data in less developed countries showed us that we need better measures for identifying problems and better prevention methods. Now that we've seen what the recent research looks like, let's talk about you. What if you want to write your own article about this topic? Let's break it down into a few key steps. First of all, you need to narrow your focus. Spinal trauma is a very broad field spanning from emergency management to long-term effects. So you need to narrow your focus. What are you going to talk about? Do you want to talk about the effects of minimally invasive surgery? Do you want to talk about the timing of surgery, or just about anything else? The more focused your research is, the more impactful it will be. Next, spend some time reading a lot of the articles that have already been published about this topic, ideally from 5 to 6 years ago. Identify what has already been done, then what's missing. That area that's missing is where your paper belongs. For example, there has been a lot of research done on timing, but not a lot of research has been conducted on rehab outcomes on older patients. My next tip is to decide which type of paper you're writing early. If you have original patient data, go for an original research article. If you're analyzing other studies, then it's a meta-analysis or a research paper. And if you have a rare or educational case, make it a case report. They're short, but they can be powerful in teaching specific lessons. Thank you for watching this video. I hope you found it useful. If you have any experience regarding spinal trauma yourself, or if you have any ideas that I didn't talk about in this video, please mention them in the comment section. We do actually read your comments, and your comments might also inspire a future episode.